So since the beginning of May, there have been 7 confirmed cases of monkeypox and 1 additional probable case reported from the UK. As Sose has said, we are working very closely with our regional office, with European Centers for Disease Control, and primarily the UK Health Security Agency to evaluate each of these cases, the source of their infection, forward contact tracing to ensure that there isn't further human-to-human transmission, as well as back contact tracing to better understand the source of their infection. These are separate incidents. There's one case with recent travel, as you mentioned, Helen, that came from Nigeria, and of course there's contact tracing that's ongoing with that case. In addition to that, there is a family cluster with 2 confirmed cases and 1 probable case that was recently reported from the UK. Following that, the UK Health Security Agency reached out to a number of health clinics, and in doing so identified an additional 4 lab-confirmed cases that were identified through sexual health services in some of the services across London and in Newcastle among men who have sex with men. And so what we're looking at here is a number of studies that are ongoing to better understand, number 1, the extent of circulation of monkeypox in London among communities with men who have sex with men, and making sure that testing is occurring, that isolation of men or people who are suspected of having monkeypox are isolated and that they receive the appropriate clinical care. And as Sose has mentioned, what we really need to understand is the basic epidemiology of monkeypox. This once again highlights the threat of viruses like this. This is an orthopox virus. This is one that is on our radar, of course, but we really need to better understand the extent of monkeypox in endemic countries like in DRC and in Nigeria, Central African Republic, and others, to really understand how much is circulating and the risk that it poses for people who are living there, as well as the risk of exportation. So we are working with a number of partners to pull together, advancing our understanding on the epidemiology in terms of transmission, and especially the use of antivirals, the use of vaccines to help prevent this. So, as you've heard the Director General talk about many times, COVID-19 is just one of the viruses, one of the diseases that WHO is looking at. Monkeypox, of course, is another, Ebola is another, and there are many others. Those we cannot afford to take our eye off the ball on. And so there are many people that are working on this. But at the present time, it's 7 cases, confirmed cases in the UK, with an additional 1 probable case. So there's a number of key actions that are underway in the UK, as well as in countries across Africa. So we'll update you as more information becomes available.